His Excellency President Dr. Irfan Ali last evening announced significant adjustments to the salaries of several categories of health professionals. I have with me in studio to discuss the announcement made by the President, the Honorable Dr. Minister Singh, Senior Minister in the Office of the President with responsibility for finance, and of course the Honorable Dr. Anthony, Minister of Health. Gentlemen, good day and welcome to this discussion.
Thank you
Minister,
very much.
I want to start with you as the subject minister for the sector. The adjustments in many instances, more than 50%, I think, in one instance, over 70% adjustment to the salary of one category. Your initial reaction to the announcement by the President, bearing in mind and taking into account the fact that there has been significant calls by healthcare professionals for some time now, for adjustments to their salaries.
Well, I think this has been one of the best news healthcare workers can have at this time of the year. As you rightly said, this was something that persons were asking for some time, for these adjustments. And as you know, His Excellency the President is one that listens, and he has been listening to the call of healthcare workers, and so today we have seen those announcements. We in the sector, we are extremely pleased with this increase in salaries in all categories. We have seen the adjustments for allied healthcare workers, pharmacists, laboratory technicians, and many healthcare workers that would normally assist doctors and nurses in doing their jobs. And all of these categories of persons would have seen significant increases in their salary. We've also seen significant increase in the salary of nurses, starting from nurse aide, nursing assistants, midwives, staff nurse, midwives. So all of these categories would have seen a significant increase in their salaries, and I'm sure they're absolutely grateful for these increases. Doctors, young doctors coming into the system as interns, they have seen a big increase in their stipends. And we have also seen for government medical officers. Initially, when you become a government medical officer, basically you stay at that salary for many years. But in this current arrangement, what was done was that you have after you've spent a year, after you've spent 2 years, 3 years, 4 years, the salary would have increased for all these persons who have spent X amount of years in the system. And I think people appreciate that because, it's one thing graduating as a medical doctor, it's the other thing accumulating experience. And people, the doctors themselves, are truly appreciative that that experience has been taken into account. And of course, we have our specialists, persons who have spent additional time trying to get postgraduate degrees and so forth, that there's also an appreciation in terms of the increase in salary. And so I think all around, everyone in the public sector is extremely pleased by His Excellency's announcement and the call that they're motivated now to do even better in the health sector.
Dr. Singh, I'm sure you had to crunch some of these figures, and this is certainly going to inject a significant amount of money into the economy, increasing the spending power of many persons in the health sector. Your initial thoughts?
Sure. So thank you very much, Eddie. And once again, it's a great pleasure to be here with you and my distinguished colleague, the Minister of Health, on this program. Let me first of all say that I associate myself with all of the comments that Minister Anthony has already made, and in particular to say that this is really a very significant and momentous announcement that has been made by His Excellency the President. It, of course, focuses particularly on technical professionals serving in the public healthcare system, but it comes on the heels of a similar announcement that was made just about a week or two ago on selected categories of members of the disciplined services. So this represents in some sense what could be described as phase 2 of a phased approach that President Ali and our government have adopted to address some of the anomalies that exist in the salaries that are paid to public sector employees, and in particular to ensure that certain specialized categories of jobs remain attractive to the most talented young Guyanese. In the case of this announcement, I would maybe offer 2 or 3 main observations. The first is it represents a significant, at the aggregate level, it represents a significant increase in the emoluments paid to public healthcare professionals. We anticipate that it will see the injection of more than $1.5 billion annually into the disposable incomes of public healthcare professionals. So every year, those who are working in the public healthcare system will be taking home in excess of $1.5 billion more in 2023 than they did in 2022, exclusively as a result of these announcements that have been made. So that's another $1.5 billion injected into the economy. So that's if you look at this at the aggregate level. And of course, that then multiplies itself over and over multiple times into the economy, because they then consume goods and services. They're then better able to, meet their own, domestic needs, whether it is to build a home, upgrade their home, buy a car, buy things for their family, buy things for their children, live a little bit more comfortably. So that multiplies itself many times over in the economy and helps to address quality of life as well. But beyond the aggregate level, if one were to peel that layer off and go down to the next layer, we want to be able to attract talented young people into the public healthcare system and retain the talented people that we already have. And we want to motivate and incentivize them to remain committed to the public healthcare system and to even further consolidate their commitment to the public healthcare system. And this range of announcements specifically speaks to that objective, because the public healthcare system has, of course, hundreds of very talented and very dedicated doctors, hundreds and hundreds of very talented and dedicated nurses, dozens of very talented pharmacists, pharmacy assistants, etc., technicians, etc. We want to make sure that we continue to be able to attract good quality input, and we want to make sure that in terms of, in terms of the talent pool, we want to be able to attract people with good qualifications, and we want to be able to continue to retain the very talented people that we already have in the system. And this announcement seeks to address specifically that. So, for example, Frank mentioned a number of categories. Let's take doctors, GMOs. Historically, there's been an anomaly, because within the Georgetown Public Hospital system, doctors are recognized, young doctors are recognized for the number of years of experience that we have. So you come in as an intern, you do your rotations, you become a medical officer. After completing a year within the GPHC system, you move up to what they call postgraduate year 2, and then I think postgraduate year 1, postgraduate year 2, postgraduate year 3, and then beyond. And every additional year that you spend in the system, you get an adjustment to your salary in GPHC. That did not obtain across the rest of the public healthcare system. We're fixing that anomaly now. So across the entire public healthcare system, whether you're working in GPHC or Linden Hospital or Mabaruma Hospital or New Amsterdam Hospital or Lethem Hospital, wherever you're working, this graduated system that remunerates you at one level when you're an intern, moves you up when you become a full-fledged GMO, when you're qualified fully as a doctor, you become an entry-level GMO or a government medical officer, moves you further up when you complete 1 year of experience, 2 years, 3 years of experience. That arrangement, which previously obtained only at GPHC, is now applied across the entire system. So doctors in Linden, Mabaruma, Lethem, everywhere will now benefit from Leonora, everywhere. West Demerara, literally everywhere. I don't want to go through all of the regions. But, that matters, because we want to make sure that the same incentives that exist for young doctors to stay at GPHC also exist for doctors throughout the public healthcare system, and this announcement speaks specifically to that. Similarly, there are a number of categories of workers where, we have people who have served for a number of years. If you think of nurses or experienced nurses, the medics category of workers. This are now pharmacists. As you know, a very significant announcement. Pharmacists got in excess of 60% salary increase based on this announcement. For those categories, we want similarly to make sure that we're able to retain people and motivate them to continue to work and work in the dedicated fashion that so many of them have been working for many years. And then thirdly, I want to make the following point, that the President and Minister Anthony have often spoken about the transformation that's taking, and all of us in the Cabinet have spoken about the transformation that's taking place in the country under this PPP government, and in particular about the transformation that's taking place in the public healthcare system. President has spoken, Vice President, Prime Minister, Minister Anthony have spoken about the big investments that we're making in public healthcare. Brand new hospitals. We had a turning of the sod for a brand new maternity and pediatric hospital, which is going to be a world-class facility. Six brand new regional hospitals across the length and breadth of our, several regions in our country are going to have a brand new regional hospital. 4 brand new telemedicine centers that are going to be located across particularly our hinterland regions to make sure that in the hinterland, world-class diagnosis is available in a timely manner. No longer will patients have to fly out to a coastal facility or a large referral facility to be able to get good quality diagnosis. They'll be able to get that in situ. You walk into a hospital, one of these 4 telemedicine centers anywhere in the country, and in situ, in that location right there, the necessary tests are done, transmitted electronically, read, diagnosed, and the diagnosis sent back immediately. And even doctors interacting with the patient using remote technology. Now, these are major investments that we're making. Upgrading the Georgetown Hospital, upgrading the Linden Hospital, upgrading the New Amsterdam Hospital. These are major investments that we're making. And what today's announcements by the President points to is the fact that not only are we investing in the bricks and mortar, the physical facilities, but we want also to make sure that we invest in the human resources of our public healthcare system. And this announcement is a manifestation of our government's commitment to investing not only in the infrastructure, not only in the equipment, the buildings, the hospitals, the modern equipment, which we've been doing in a very aggressive fashion, but also investing in the people who man these systems and who are so critical to delivering quality healthcare to the people of Guyana.
Dr. Anthony, quickly, and I think Minister Singh touched briefly on this, because one of the things that we've been seeing over the years in the health sector is that even in some of our CARICOM neighbors, you're able to attract a lot of our talent because of the remuneration. How do you see this or these adjustments working in favor of retaining more of our talented professionals, as you said?
I think with these adjustments, certainly we would see more people staying at home, because I don't think people really want to leave Guyana and go away. Some of them did that because they felt that they had better opportunities abroad. But with the changes that Ashni just described, where we are building new facilities, putting in new equipment and all of that, the environment here to practice medicine is changing drastically. Also, the types of training that we've been offering would allow people to want to be here, to be proud to be here, and to be able to do cutting-edge medicine. That's what we are gearing the system towards. And with this increase in salaries, certainly we are going to become more competitive in terms of retaining persons in the system and being able to offer a better quality of care. So, you know, we have oftentimes spoken about this comprehensive approach to health. And what you've seen here with the President's announcement is really not just focusing on one aspect, but looking at it in its totality. And we cannot look at this system in totality if we don't focus on our human resources. And this announcement really touches on that, addresses this, the human resource aspect and retention of human resources.
Dr. Singh, your closing comments, taking into account the fact that, like you said, this is a significant injection in the economy, but also this has significantly improved the spending power, if you want, of healthcare professionals. And I know there might be more of this coming from other categories of workers, not only in the health sector, but maybe in other sectors.
Sure. So you are right that, I mean, the President was very deliberate in speaking of a phased approach. So this is phase one was the discipline services, phase two is the public health care professionals, and we will continue this phased approach. But I want also to make the following point, and really to build on something that Frank spoke about, you know, the vision for the healthcare sector, and he spoke about the training opportunities and so on that have made, you know, the service in the public healthcare system, you know, increasingly attractive. The President has also spoken about an even longer term vision for healthcare in Guyana, and it's one that sees Guyana not only being able to deliver world-class healthcare to all of the citizens of our country and residents in our country. Clearly that is one aspect. And within that aspect, we see a role not only for the public sector, but we see an important role for the private sector. So for example, we are encouraging private sector investment in healthcare. One of the first things that this People's Progressive Party government did when we came into office was to remove corporate taxes on companies operating in healthcare. And that was designed to incentivize companies, make Guyana an attractive place for companies to come and do business in healthcare. We have also entered into strategic partnerships with international partners, world leaders, including the Mount Sinai system of the state of New York. And on another occasion, when time permits, I'm sure Minister Anthony will speak a little bit more about what we're doing, but that's a world-class player that we're partnering with, you know, to bring us up to a point where we are really delivering world-class care, where we have the capability to deliver world-class care involving both the public system and the private sector. And we value the investments by the private sector, and we're encouraging the private sector to invest more aggressively in their capabilities, because there is an important space and an important role to be played by the private sector in the provision of healthcare services, as is the case in any modern economy around the world. But the vision also includes and involves us getting to a point where not only do we provide world-class care to all of our citizens, but where we become a destination for medical tourism, what's called medical tourism. We want to get the healthcare system up to a point where even persons from the Caribbean, even persons from the diaspora can come to Guyana. There are many members of the diaspora that are waiting on a waiting list somewhere, awaiting attention. They're Guyanese. We want them to be able to access good quality care here, that they're comfortable coming back to their home in Guyana and having access to good quality care in a timely manner. And even persons in the Caribbean, just as persons, you know, we all know of a time when Guyanese persons used to, you know, if the circumstances warranted it and they were able to mobilize the financial support to do it, they would travel to Trinidad and Tobago to get medical care, or Jamaica, or Cuba, or wherever else. Like I said, if the circumstances required it and if they were able to mobilize the financial support to facilitate it, we want to get to a point where, in fact, the flow of traffic is in the reverse. And not only do Guyanese feel comfortable staying at home and are able to get world-class care, but indeed that others will see Guyana as a destination to go to in order to get good quality medical care. And so that, in fact, is the ultimate destination that we want to get to. And there are many pieces to that puzzle. Infrastructure is one. Human resources is another. Of certainly no equipment. Infrastructure is one. Equipment is one. Performance management is another very important dimension, ensuring that the system works efficiently, consistent with a modern healthcare system. And of course, integral to that is human resources. And remuneration is an important dimension to that, and we are, taking yet another step to. I should mention, in fact, that the announcements that were made are on top of the 8% across the board that was awarded in 2022. So there's an 8% across the board increase awarded for 2022, and these additional increases are granted on top of that 8% with effect from 1st of January 2023. And so HR is an important dimension of this. Remuneration, within HR, remuneration is an important aspect. And then, of course, very critically, and I will end on this note, Frank spoke about it, training. Training our professionals in the public healthcare system to raise their technical capabilities, but also training to address things like customer and patient care and quality of service and so on. So there are many dimensions to this, and there is a very clear long-term vision that our President has articulated, that Minister Anthony has articulated on many, many occasions, and we're going to continue to work diligently to realize that vision.
Gentlemen, I want to thank you very much for joining me to have this initial discussion on the President's announcement. And of course, I think healthcare workers, all the categories, and workers generally, I think, are looking forward to what is in store, because we've seen consistently benefits being given to workers and to all Guyanese across the board, even during the pandemic and now beyond the pandemic, fulfilling many of the promises made by the People's Progressive Party Civic on the campaign trail. So, gentlemen, it's a pleasure to have you here this evening, and to viewers and listeners, we want to say thanks for watching.
Thank you very much, Eddie.